help you today?
Okay, my 3-year-old daughter, she has a speech delay, she has trouble making friends, she doesn't make eye contact with anybody, and she has a hyperfixation on drawing. What's wrong with her? Is my child sick?
Okay. Based on the symptoms, I think your child may have a neurodevelopmental disorder. Have you ever heard of Autism Spectrum Disorder or ASD?
No. What is ASD?
ASD is a heritable mental health disorder characterized by its diverse symptoms associated with deficit in social, communicative, and cognitive skills. According to an article by Catherine Lord and other researchers in 2020 and the Institute for Public Health (IKU), the symptoms your child is experiencing are among the few textbook signs of ASD, while other symptoms may include resistance to small changes, a hyperactive nature, as well as being sensitive to certain sounds. While the diagnostic process is complex, your child has checked the main criteria for an ASD diagnosis based on Hirota and King in 2023, which include problems in reciprocating socially and emotionally, poor nonverbal communication skills, and difficulties in developing and maintaining relationships, in addition to restrictive and repetitive behaviors. With further screening and diagnostic assessments, you'll receive a comprehensive diagnosis for your child.
Really? How did this happen? Was it something I did wrong?
While there are maternal risk factors like smoking, giving birth at an older age, and a history of psychiatric disorders, as well as birth complications like birth asphyxia, where the baby's brain and organs receive insufficient oxygen and nutrients as reported by the Ministry of Health Malaysia. Moreover, Hodges and his team of researchers also noted in 2020 that some genetic disorders like Rett syndrome and Down syndrome are associated with ASD, but they are only account for a very small number of cases. Environmental factors may also affect a child's brain development, but sadly, there is no single unifying cause for ASD as research is limited.
Oh no! How common is ASD in Malaysia?
Well, a 2015 technical report on ASD research published by the Ministry of Health Malaysia stated that 1 in 625 Malaysian children in 2005 have ASD, and that 5.4% to 9.5% of children with disabilities have ASD. Despite this, the number of cases is a lot higher now, likely due to underreporting in previous years. The National Autism Society of Malaysia, or NASOM, refers to ASD as one of the fastest growing disabilities, flowing report from the Centers for Disease Control and Prevention that the incidence or number of new cases of ASD is 1 in 68 children, meaning approximately 9,000 Malaysian children are born with ASD every year. Meanwhile, an article by Maynard in 2023 reported that the prevalence or total number of cases of ASD is 1 in 36 children worldwide, according to the CDC's Autism and Developmental Disabilities Monitoring Network. In addition, while both genders may be affected, an article by Maynard in 2023 noted that ASD is almost 4 times more common in boys than girls. Thus, as increased awareness for ASD over the past 20 years has increased the number of case reports, ongoing efforts to raise awareness for this public health issue remain crucial so those affected can receive the help and support they need.
Oh dear, this is the first I've heard of ASD. I feel so lost.
Yeah, we completely understand your situation. The lack of public awareness and government-supported services for children with ASD can be overwhelming for parents. The Ministry of Health Malaysia has reported that not only does ASD challenge the child's social and intellectual capabilities, the parents, especially the mothers of children with ASD, are more likely to experience hopelessness, anxiety, and have a negative attitude towards ASD, with around 23% of Malaysian mothers of children with ASD showing significant depression levels. Despite this, do know that this path is not a lonely one. The report shows that the parents of children with ASD manage their distress via religious means or family support. Even though government support for ASD may be lacking, the non-governmental organizations like NASOM provide accessible services and resources that may help you and your family navigate through this.
That is good to hear. are there any treatments for ASD or even a cure?
Sadly, there is no cure for ASD. According to Hirota and King in 2023, medications prescribed to patients with ASD tend to focus more on alleviating co-occurring psychiatric conditions instead of core ASD symptoms. For example, aripiprazole for dysregulation in behavior and emotions. On the other hand, the Ministry of Health Malaysia has reported promising achievement rates of 40% to 85.71% via around 6 months of early intervention programs, EIPs. These programs are specifically designed to involve parents, the child's interests, and developmental goals, along with engaging activities in a predictable and comfortable environment to yield the best results. The incorporation of information and communication technology, ICT tools like tablets and media, as well as other interactive activities like music therapy, brain training, and physical training provide further assistance towards the child's individual developmental goals. Furthermore, applied behavior analysis, ABA, is an alternative therapy option in the management of ASD when performed by trained professional practitioners in a targeted and individualized fashion to improve individual behavioral concerns, as stated by Anderson and Carr in 2021. Osman and others also reported in 2023 that speech therapy benefits children with ASD by overcoming the characteristics like minimal eye contact, as well as difficulties in verbal and social communication skills. With all that is said, early intervention is an essential management strategy for neurodevelopmental disorders like ASD. So, we suggest you to contact NASOM as they provide services like EIP, as well as other programs to improve the lives of children with ASD. You may visit their official website or click the link in the description to learn more about NASOM.
Thank you very much. I will further educate myself on ASD and spread awareness in my community. Goodbye.
Before ending the video, let's do a quick Q&A. Firstly, what is ASD?
That's right. ASD is a complex heritable neurodevelopmental disorder characterized by a decline in social, communicative, and cognitive skills.
Great job! Secondly, according to NASOM, roughly how many Malaysian children are born with ASD each year?
That's correct. Roughly 9,000 Malaysian children are born with ASD annually.
Amazing! Lastly, what are the most common treatment for ASD?
Good work! Early intervention programs, EIPs, along with ICT tools and interactive activities are the most common treatments for ASD.
On behalf of all my group members, we hope that this video helps to spread awareness for the public health issues of ASD. As a final message to those diagnosed with ASD, know that you are not alone in this work.
This mental health journey may be tough, but your strength, courage, and resilience has deeply inspired us and will continue to inspire others as well.
To the families of those with ASD, your unwavering support and love in addition to early intervention will aid your loved ones in overcoming this daunting lifelong disorder, improve their quality of life, and prepare them for the challenges ahead.
To the public, your acceptance and understanding for those impacted by ASD are greatly appreciated. We hope that after watching our video, you will educate yourself and those around you about ASD, so those affected can live in an inclusive and safe environment.
We included links to credible sources and organizations that support ASD in the description and comment section, as well as our social media accounts devoted to raising awareness for ASD. Thank you for watching our video. Please click the like button and share with your friends and family.
Goodbye.